The bright side of addiction and mental illness is recovery. And recovery is as recovery does. And recovery is living proof. I'm Neil Scott, and if you are new to our podcast, we welcome you. And if you have been here before, we certainly welcome you back. And if you're in recovery or know or love someone who is, or you simply want to know more about the recovery process, or maybe you're a bit concerned about someone you know or love who is harmfully using alcohol or any other drug, or is having a mental health crisis, this is the podcast for you. We carry the message of hope and the promise of recovery. And a reminder that you can find all of our podcasts at recoverycoasttocoast.org. Recent episodes have featured historic interviews with Betty Ford, actor John Larroquette, astronaut Buzz Aldrin, musician Bonnie Raitt, authors Brene Brown, Anne Lamott, J.A. Jance, and others, former NFL player Ryan Leaf, and former NFL star Thomas Hollywood Henderson. All these interviews and more are on our website, plus conversations with everyday people in long-term recovery, sharing their story, their insight, and their path. Now, this is a special edition of Recovery Coast to Coast because, as I do every year, I'm going to share some highlights from the recent Behavioral Health Legislative Forum in King County, Washington, where state and regional legislators met with a sold-out auditorium of people in recovery and people who are concerned about recovery from addictive disease and mental illness. It was a tremendous opportunity for legislators to see and hear firsthand why treatment works and the benefits of long-term recovery. We'll hear from some of those who told their story and the reactions from some of the approximately 20 legislators that were in attendance. Here's a quick clip from the podcast from one of the three people in recovery who told their story at the Legislative Forum.
I started using fentanyl and meth heavily. I became homeless, cut off communication with my parents, and lived on the streets of downtown Seattle. I want to make it clear that I am a survivor of the fentanyl epidemic. Fentanyl almost took me, and it has taken so many people I love. It consumed every part of my life, my energy, my hope, my morals, and my values. It was the only thing that mattered to me. I lost myself completely.
And we'll hear from elected officials as well as everyday people in long-term recovery, and it's coming right up. I'm Neil Scott, host of Recovery Coast to Coast, so thankful and filled with gratitude that you chose to listen to our podcast. There are many podcasts on recovery. I am blessed and honored that you have chosen ours. Our website is recoverycoasttocoast.org. Following 17 years of nightly broadcasting on iHeartRadio in Seattle, our podcast features interviews with everyday people in recovery, as well as clinicians, authors, and recovering celebrities. We offer the promise of hope and the reality of recovery, plus well-vetted resources for individuals, families, and friends. We invite you to enjoy it and to share it with one other friend as well. Recovery is an American way of life. A reminder, our email address is recoverycoasttocoast@comcast.net, and we would love to hear from you. Recovery Coast to Coast is supported by Sundown M Ranch, one of America's oldest, least expensive, and most successful treatment programs. Now, as you will hear in today's podcast, treatment works and recovery follows, long-term recovery. And that's the goal of treatment at Sundown M Ranch. Their motto is, "The patient is the reason we are here." And they have been there for tens of thousands of individuals, including adolescents and family members. Sundown will soon celebrate its 60th anniversary. Now, what's the key to their success? What do they do that other treatment programs don't do? Well, first of all, they keep their rates low because they are a not-for-profit treatment center. Their bottom line is not financial. It is the bottom line of personal recovery. They also boast an exceptional staff that has been together a long time, and some of them who actually went through Sundown M Ranch. And they help to create a loving community. They provide all the tools necessary to assure long-term recovery. And in reality, it's kind of a partnership between the treatment team and the individual. The individual follows the treatment and recovery path, and good results follow. Sundown does not treat and release. They have a robust continuing care program, easing the transition back into everyday life. Treatment at Sundown is covered, by the way, by most insurance plans. Sundown, it's where recovery begins. Sundown.org. All right, time for a nice cup of coffee, and hopefully you'll join me with your favorite beverage. The annual King County Behavioral Legislative Forum was held recently to a full house. Now, I was privileged to be the MC and moderator for the evening, as I have been doing for, 10, 15 years. We will begin with introductory remarks along with some of the stories by people in recovery from addiction and or mental illness. And we will also hear from some of the legislators on the impact their stories had on them. The evening began with Susan McLaughlin. Susan is the Behavioral Health and Recovery Division Director at King County, a licensed clinical psychologist. Susan has more than 20 years of experience in healthcare, behavioral health, and social services. In her role, she oversees behavioral health treatment for the entire region.
We believe every person deserves access to high-quality behavioral health care regardless of their background or circumstances. Tonight, I want to kick off by talking about progress because it's important for us to acknowledge how far we've come as we think about the many challenges ahead. Now more than ever, our state and local government action is necessary to protect our progress and keep intact the critical work we do to make behavioral health services and treatment accessible for all. We know that mental health matters, that treatment works, and that recovery is possible. We've made tremendous progress over the last year. Just want to cover a few of those. Last year, outreach to the 988 Behavioral Health Crisis Line increased overall, with over 9,000 phone calls, over 1,200 chats, and nearly 3,000 texts coming in each month. Crisis care is now available 24/7 today for everyone in King County, regardless of insurance or ability to pay, at the first King County Crisis Care Center, which was established in Kirkland. And this year, we will close on the purchase of a second crisis care center located in the Seattle area as we continue to work to create a network of 5 centers around the region. There are more mobile crisis teams, both for adults and for youth, who are responding in person to help people across the county. And we've invested over $16 million in our behavioral health workers around the region to support things like training, recruitment and retention, professional development, among many other things that goes to. With help from our partners at Public Health Seattle and King County, we've increased the distribution of naloxone to our community-based organizations. This is a life-saving overdose reversal medication. We're on pace to double what was distributed last year. We also launched a new buprenorphine prescribing line where anybody can call to talk to a physician and get a prescription for buprenorphine, also a medication to treat opiate use. This telehealth program has served more than 1,000 people to date. King County has seen a steady overall decline in fatal overdoses over the last 2 years, and it is because of the collective efforts of everyone in this room that we are seeing those results. Workers. And then our final behavioral health legislative priority is protecting permanent supportive housing that is threatened by the federal government. Permanent supportive housing provides critical housing paired with services and supports to individuals with mental health and substance use conditions. We all know how stable housing is fundamental to a person's overall health and well-being. Here in King County, we've seen firsthand what's possible when people can get the treatment they need in stable, supportive housing environments. For example, within the first year of moving into a health through housing building, residents experienced a 17% decrease in emergency room visits and a 33% decrease in hospital stays. By leveraging existing strategies and enhancing the ways people access care, we together are making a difference, and we need to celebrate that. So thank you all.
Now let's hear from the first of 3 exceptional speakers, letting the assembled legislators know that recovery is real. Susan McLaughlin did the introduction.
It is my honor to introduce our first recovery speaker for the night, Juju Pierce. Juju is an Indigenous graduate. She's an Indigenous graduate of Interagency Recovery Campus, which is the only public sober high school in Washington. It's also celebrating its 10th anniversary this year. She's part of our Bridges Alternative Peer Group, and she's an aspiring substance use disorder counselor, our workforce of the future. She's a remarkable young woman, and her story is a testament to her strength and community. And so please help me welcome Juju.
Hi, my name is Juju. I'm an Indigenous woman in recovery for almost 2 years. I want to thank everyone here for allowing me to share my story today. My journey with substance use started long before I understood what addiction even was. It has taught me about resilience, community, and the power of support. I'm here to speak about the importance of accessible recovery resources and how they change and save lives like mine. Both of my biological parents struggled with substance use and serious mental health disorders. Because of the complications that came with that, I was placed in the foster care system at a very young age. Eventually, I was adopted by my wonderful parents, and while they provide me stability and I was mostly a happy kid, I also struggled deeply with my identity as an Indigenous child in a white household. I often felt unseen and unfit for my environment. That lack of belonging ended up following me. At the age of 11, I ran away from home to find my birth parents. I thought that reconnecting with them would fill that emptiness, but instead I was introduced to methamphetamines by my birth father. My use wasn't daily back then, but it planted a seed that would take root and grow over the years that followed. The following year I was arrested. As a part of the process, I was ordered to complete community service and attend therapy at the Cowlitz Tribal Health Center in Tukwila. It was there that my therapist helped me see something I could not yet understand, that some of my behavioral issues were symptoms of a deeper substance use disorder. But because of my age, residential treatment wasn't an option yet, and my substance use disorder was not recognized. I received help, but I wasn't ready to stop. Addiction had already found a home in me. At 14, I went to rehab for the first time. I needed to complete treatment to attend the recovery high school on Queen Anne. The school and amazing staff helped me stay sober for 13 months before a close friend ended up passing away. This loss broke me and I relapsed. What started as a way to cope became the thing that nearly destroyed me. With that relapse, my addiction escalated. I started using fentanyl and meth heavily. I became homeless, cut off communication with my parents, and lived on the streets of downtown Seattle. I want to make it clear that I am a survivor of the fentanyl epidemic. Fentanyl almost took me. Fentanyl almost took me, and it has taken so many people I love. It consumed every part of my life, my energy, my hope, my morals, and my values. It was the only thing that mattered to me. I lost myself completely. I was in an abusive relationship during the time. My boyfriend noticed an abscess on my leg from using and dropped me to the drop-in center. It was there that I met Johnny Ota, Dr. Taryn Hansen, and the staff at UDYC who would change my life. They didn't judge me. They didn't give up on me. Their compassion planted a small spark of hope, even though I wasn't ready to quit yet. One day, I came back to the place I was staying downtown. I saw mice crawling around, overdosed rodents in the garbage can, holes in my face, stolen computer parts, and whatnot. I finally was able to see how I had been living for months. That moment struck me with guilt. I knew I couldn't keep living that way. I called my father and I told him I wanted to go to rehab, but I needed 5 more days before I went. My parents were desperate to help, but they also knew that forcing me wouldn't work. I had to make that choice myself. When I finally went back to rehab, this time at Hazelton, it was different. I wanted recovery more than I wanted to die. When I got out of rehab, I cut ties with everyone connected to my addiction. I got on Sublocade, a medication that continues to help me stay drug-free. I kept working with the wonderful people at Ryther and did almost everything that was suggested to me. I returned to the recovery high school expecting people to resent me, but instead they welcomed me with open arms the same way they had before. The unconditional support reminded me that I was still worthy of recovery and belonging, and that I still had years ahead of me, not to use, but to recover. I started rebuilding relationships with my parents. I began setting goals again. For the first time in years, I could picture a future for myself, and I knew what I wanted. My recovery has taught me that addiction is not a moral failure. It's a disease that thrives in isolation and hopelessness. So many times I wanted to stop. I went to detox, rehab, NA meetings, but I couldn't stop myself. The only reason I'm standing here today is because of the programs who believed in me when I didn't believe in myself, like Ryther, the Cowlitz Tribal Health Center, Hazelton, Bridges. Access to Sublocade and Suboxone in Recovery High School made me make my recovery possible. They gave me support, compassion, and accountability, but most importantly, they gave me an exit route when I was ready to get clean. After getting clean, my life started changing for the better. I took on a leadership role at Bridges APG, which helped me learn accountability and what it meant to show up for others. A big part of my stability has come from the community at APG and Recovery High School. Sublocade's been a consistent and reliable part of my recovery that's helped me stay grounded and focused. At almost 2 years clean, my life looks completely different. I'm a trusted and respected person in my community, and I have the chance to share my stories with others in a positive light. I'm able to hold a steady job and spend real peaceful time with my family. I enjoy my normal problems, now the kind that come with living a stable, honest life. It's the small moments like dinner together that remind me how far I've come. I can now envision myself in a place where I can help other people just like me and show them that it might not feel so, but it's normal for us. My story is just one of millions, but I hope that it shows what's possible when people are given the chance to heal. Thank you for listening, and thank you for continuing to make recovery possible for more people like me.
Wow. Legislators, that is what recovery is all about. Thank you very much, Juju, for your courage tonight, sharing your story, and congratulations on your journey. Recovery is the journey back to self, and it's living proof you don't have to die for a drink or a drug. Before our next recovery speaker, let's hear from some of the assembled state legislators from King County.
My name is Sean Scott. I represent the 43rd Legislative District in the Washington State House of Representatives alongside my seatmate Nicole Macri and Senator Jamie Peterson. We are made privy to polls that are taken by our House Democratic Caucus that indicate the popularity of various issues across the state of Washington. If I recall correctly, behavioral health and supporting behavioral health was the first or second most popular statewide issue that House Democrats could have supported on. In other words, there were no other issues that were more popular than the one that we are gathered to discuss today. If this is such a popular issue statewide, and we know it is a popular issue within many of our individual districts, why have we not necessarily seen the kinds of progress that we should have liked to have seen on this issue? The fact of the matter is that massive corporate lobbies have spent this year alone upwards of $2.1 million to influence the state legislature against progressive tax policy that would fund some of the programs that we're discussing.
Good evening, everyone. My name is Nicole Macri. I use she, her pronouns, and I also am just so honored to represent the 43rd Legislative District in Seattle. We have done a lot to invest in behavioral health crisis services, but we know we are nowhere near meeting the demand. And we know with shifts in federal policy and cuts in federal funding that we expect to see more people coming to crisis services, either mobile crisis services, calling our hotlines, or showing up at the crisis care centers that we have available and that we are planning to open in the coming years. And so those are a few issues. I have been a big champion around expanding access to long-acting injectable buprenorphine, and other medications for opioid use disorder. These are life-saving medications, and we need to make sure that they continue to be available, and I'm particularly focused on how we can expand access to those medications, not just in our behavioral health community clinics, but in our child welfare system and in our prisons and jails. So those are a few things that I'm working on.
Good evening, everyone. My name is Manka Dhingra, and I represent, thank you. And I represent the 45th Legislative District. I am so glad we had all the conversations about taxes and revenue, because that's what we're dealing with next year. And I want to be very clear that the policies at the federal level come from a place that is based in, frankly, either indifference or worse, simply being evil towards people, because that is the consequence of what we're going to see. We're going to see dramatic increases in the number of uninsured individuals in the state of Washington. That is the reality. We're not in a position to backfill all the insurance or all the individuals who lose their insurance in the state. But what we can do is make sure that we are looking out for each other the best way that we can, which means each and every one of us is going to have to take that responsibility to look out for our neighbor, for our friend. I am so very proud that every time I talk about our 988 system nationally, we have one of the highest rates of phones being answered in the state of Washington, which is incredible. But we know we have to build on that system, and so I don't want us to lose momentum, but I want us to make sure we continue down that path in creating the system that each of our loved ones deserve to go through if they need that help.
Good evening, everybody. I am Jamie Peterson. I also represent the 43rd Legislative District, so that's the middle of Seattle. And I currently serve as the majority leader in the Washington State Senate. I am struck as I read the priorities that you have here by the verbs protect, sustain, stabilize, resolve, continue. I mean, it's a pragmatic agenda, right? But we know that it is not even remotely adequate to meet the tidal wave of behavioral health need that we all see every day in our streets, in our communities. So my priority for this next session is to turn the ship around in terms of our broken tax system so that we have enough revenue to make these kinds of investments in the people of our state.
Good evening, everyone. I'm Roger Goodman, and I'm also from the 45th Legislative District. It looks like the 43rd sticks together, the 45th sticks together. I actually want to say hi to Neil, because 20 years ago, 2005, wow. I was the legislative liaison for what was called the Alcoholism and Substance Abuse Administrative Board at the time. I guess it's the Behavioral Health Board now. So I've been involved in this work for a long time. I actually was in charge of putting this event together, which attracted maybe a dozen people in a small church. No, seriously, this is amazing. There's never done a better job, particularly the resources out in the hallway. A+. Incredible job. So at that time, I was working for the King County Bar Association to end the war on drugs, and I'm still working on that. We have cranked it down quite a bit. Echoing Susan McLaughlin's remarks, think how far we have come. It was just a dozen people in a church 20 years ago. Now, the stigma really is wearing away, and families care, and we want to go public about this. And also think how far we've come in terms of the legislature, acknowledging that behavioral health really needs to be right in the middle of our radar, and it has been. We have a long way to go, but we have come a long way since, despite the budget challenges and the political and cultural and economic challenges facing us. So thanks all of you for standing up for those you love, and also for coming here tonight.
Well, hello everyone. Really great to see you all here today. My name is Usman Salahuddin. I'm a state representative from the 48th Legislative District, which is Bellevue, Redmond, Kirkland, and the Points communities.
Hi, my name is Sunshine, staff director in the 46th District, so Northeast Seattle. I've been working with Representative Farvar for about 6 years now, and when I met her, I was someone whose life had been profoundly impacted by mental health struggles and substance use. And last year, I had the honor of attending this event for the first time, and I remember listening to the speakers' stories and thinking that there was a time when I never could have imagined being alive to sit in that seat. And listening to the stories that we've heard this evening, I feel that way right now. And for anyone who can relate to that story, I'm glad that you're here with us. I'm so proud to be supporting Rep. Farvar, and she looks forward to continuing to protect access to culturally responsive care, care that isn't one size fits all, and deliver services when and where we need them.
Good evening, everyone. My name is Manka Dhingra, and I represent, thank you. And I represent the 45th Legislative District. I am so glad we had all the conversations about taxes and revenue, because that's what we're dealing with next year. And I want to be very clear that the policies at the federal level come from a place that is based in, frankly, either indifference or worse, simply being evil towards people, because that is the consequence of what we're going to see. We're going to see dramatic increases in the number of uninsured individuals in the state of Washington. That is the reality. We're not in a position to backfill all the insurance or all the individuals who lose their insurance in the state. But what we can do is make sure that we are looking out for each other the best way that we can, which means each and every one of us is going to have to take that responsibility to look out for our neighbor, for our friend. I am so very proud that every time I talk about our 988 system nationally, we have one of the highest rates of phones being answered in the state of Washington, which is incredible. But we know we have to build on that system, and so I don't want us to lose momentum, but I want us to make sure we continue down that path in creating the system that each of our loved ones deserve to go through if they need that help.
Good evening. I'm Tina Orwell. I have the honor of representing the 33rd Legislative District. I want to say welcome to the 33rd, the beautiful 33rd. Mental health has impacted me and my family. I'm a social worker, worked 25 years in behavioral health. And, I know there are times when people have reached out and had the courage to ask for help, and they haven't always received it. And sometimes they're harmed by our system. And so I've been incredibly proud to team up with Senator Dhingra and all my colleagues here on the 988 system. It's a chance once in a lifetime to really redo our crisis services so they're healing and that people do get the help that they need and deserve. And I can tell you in Kent, we have 120 languages spoken. And so we are working with our community-based organizations. I know Valley Cities is here tonight, and hopefully CMAR, and we're making sure that we're trying to team up so that not only the students but the families get the services they need.
We said we kind of feel like we're on a school bus today. I'm sitting up here. My name is Claire Wilson, proud to represent the 30th Legislative District in South King County. Woo-hoo! Hi. Protection is the name of the game for me. I chair Human Services in the Senate, and it is all things child welfare, juvenile justice, corrections, basic needs, food, shelter, and clothing, all discretionary income. And as we think about our budget crisis right now, those are things that put people out in the margins even further out and put them in a position of often doing things that put them in harm's way and put them in systems they should never be in. The other issue for me, K-12, I vice chair K-12, so early learning in K-12 is critically important as we think about family systems. And then we have to think about who's not here, and those are young people in our juvenile justice system and adults in our correctional system who deserve not to criminalize mental health or behavioral health issues or addiction issues, to get the services they need and they deserve in order to be contributing members of our community. And again, it is our situation that often is putting them in the positions that they're in. So will continue to fight in every role I'm in on behalf of those who need and deserve those services, especially when we're struggling from the inside out, and also right now with federal administration from the outside in.
I'm Lisa Callan. I get to represent with Representative Hall, the 5th Legislative District, telling your stories, your journeys, and making sure that we're hearing the humanness behind every number that we see, every budget line that we try to move forward, and every aspect of what we think from the legislature makes sense needs to be seen and told by the lives of the people that are experiencing systems that we're either funding or not funding in every way. So just deep gratitude to you all who came up and did that, and to each and every one of you that are here in the room tonight. You are bringing the human factor, the humanness to all of this work. So one of these areas, I'm hearing very loudly, right? Recovery is not linear. That help cannot be a one size fits all. Certainly help isn't help if it doesn't look and feel like help and isn't accessible to help. And that care has to be delivered with compassion and cultural understanding. And what we need to do to move forward and make a difference in that is to make sure that we're connecting all the dots, all the disconnected spaces of where we're treating and working and supporting behavioral health. How does a child from the moment it's born, how is that child, and how even the predisposition of that child from pregnancy all the way through the transitioning into adulthood to the age of 25.
Good evening, everyone. My name is Lauren Davis. I represent the 32nd Legislative District, which is, Northwest Seattle, Shoreline, and then up into Snohomish County. I stand on the stage tonight really standing on the shoulders of giants, one of whom we celebrated tonight, my longtime friend Nancy Dow, who I affectionately refer to as the OG peer, and one who is no longer here, who has a profound legacy of behavioral health in this state, which is the late former Speaker of the House, Frank Chop, whose hands and heart have shaped the system. This is the first legislative forum we've had without him, but his legacy will continue to live on. I was reminded tonight about the urgent need to continue work to address the scourge of high-potency cannabis. I met a mom tonight, one of many moms that I've met, who has an adult child who had THC-induced psychotic disorder and now lives with schizophrenia. I think you're all aware, a diagnosis for which there is no cure. So continuing work on that.
And we conclude the legislative portion of the evening with Senator Bob Hasagawa.
Well, Neil, actually, I was going to say thank you for your great service and providing your talents to support the community here for decades, I guess. But at any rate, I'm Senator Bob Hasagawa from the 11th Legislative District, which is Tukwila, Renton, Kent, and parts of unincorporated King County. So first, I guess I want to thank Hussein for putting a spotlight on culturally appropriate access to services and provision of services, because that my wife, I got to give it to her, she hammers me about this constantly. She spent decades serving in the behavioral health administrative services in San Francisco and Pierce County and Benton, Franklin County, Human Services and all that. So I am not an expert, believe me. She is, so you all are in good hands because she controls the strings. What I wanted to talk about a little bit was, you want to know what I'm thinking about. What I'm thinking about is the fabric of society seems to be ripping apart right now. And what happens when that, to all of our families, to us as individuals, when the pressures of society continue to build and build and build, we're going to see increases in the need for behavioral health services because we're all trying to adapt and figure out how do we live in this new changing world where there's so much insecurity around Where am I going to eat? Where am I going to sleep? Am I going to be able to go to the doctor if I need to? You know, there's so many insecurities that are piling on top of each other. It's going to see a huge, I see, increase in behavioral health needs, services needs, until we actually get this ship turned around. But there's hope. We need, because these crises also provide us the opportunity to look at systems changes, to really prioritize those things that are most important to us. And behavioral health services help us be the best people we can be. It's a basic human need to try and allow all of us to become the best people we can be. If we're not living our best lives, you know, there's something wrong with society, and that's what behavioral health services needs to provide, is access to those things so we can live our best lives. But that requires funding, right? And I thank you for acknowledging that we're in a difficult budget year so that you don't have multi-$100-million asks for this budget cycle, this supplemental budget. But the money is out there. Let's face it. We're in one of the wealthiest cities and regions in the country. The money is out there, but society has shifted. Our values seem to have shifted where we're idolizing billionaires and trillion-dollar corporate. Elon Musk just signed a trillion-dollar wage package. Can you believe that? A trillion-dollar wage package. Money is there, but they forget who made that money for them. It's all of us sitting here, and many of us who are suffering because we're carved out of that system. So when we think about funding, we need to consider comprehensive progressive tax reform, including, I would say, an income tax, a progressive income tax. They talk about that as being the deadly third rail of politics, but let's face it, what we got ain't working. And unless we take a systems change view of this, we're going to continue on this downward spiral. So we have to do something, but the good news is the opportunity is there now for us to do something. So I'm going to make an ask of all of you out here. This is a call to action. We can't do it as legislators by ourselves. We need the political will of the people to make this change. So go back to your organizations, your community-based organizations, and say, we have to raise new revenue, not from the poorest who can least afford it, but from those who are gaining the most out of what society has to offer, and turn that back into society so that all ships rise at the same time.
Our next speaker is Hussein Ugas. Hussein is the founder and executive director of Rama Recovery Center down in Federal Way. If you're unfamiliar with it, it's a level 2 accredited, culturally informed recovery residence serving East African and Muslim communities. A survivor of civil war, addiction, and homelessness, Hussein now dedicates his life to building recovery spaces. And those spaces bridge faith, culture, and healing across King County. Let's welcome Hussein to the stage.
Good evening, everyone. 13 years ago, I was sleeping on the cold streets of Minneapolis, Minnesota. Today, I stand before you as the founder and executive director of Rahama Recovery Center, a place of healing and hope for others just like me. Far from my time on those cold streets, homeless, addicted, and hopeless. I came to this country as a young Somali refugee, carrying trauma I didn't yet understand. I worked hard to succeed. I was a straight A student, the model refugee. But behind that image was a deep pain. You see, in our culture, mental health and addiction are a taboo. Things to hide, not to heal. I took my first sip of alcohol in 2002 at a Halloween party in Bellingham, Washington. And that one choice led to 10 years of chaos. I was a functioning addict for a while, holding jobs. I even managed to get married with a home and a son. But that illusion helped me to stay in denial. Denial about my arrest in Alaska for selling drugs. Denial about being detained by ICE for 4 months, facing deportation. Denial about lying to everyone that I loved while dealing drugs in my own home with my wife and my son. So in 2008, my world collapsed. My wife left me while pregnant with our second son. That same year, I got shot, but that didn't even stop me. I was lost, running from my pain through states, shelters, and the streets, surviving only to feed my addiction. By 2012, I was homeless in Minneapolis, Minnesota, arrested for the third time on drug trafficking charges. You see, I wasn't a dealer. I was an addict trying to survive. My public defender told me something that truly changed my life. If you go to treatment, it'll help your case. Motivated by those words, I entered a 28-day treatment program in St. Paul, Minnesota. And on my first day there, an addiction treatment counselor looked at me and said, "Hussein, you're not a bad person. You're a person with a disease called addiction." That was the first time I ever heard those words, substance use disorder. That moment broke me. It broke me open and began my healing. Afterwards, I entered a drug court deferment. I was ordered to stay clean for 1 year and an additional treatment. So I applied to 5-Star Recovery in Chaska, Minnesota for 6 months of mental health and substance use disorder treatment program with a sober living afterwards. There, a therapist helped me uncover the PTSD that haunted me since childhood. The bombs, the screams, the lifeless bodies in Somalia's civil war. I began to heal not only from my addiction, but also from my trauma. After I fulfilled my 1 year of court obligations, my cases got dropped, and I left 5-Star Recovery. I became a town car driver. I was staying sober, rebuilding my life. However, in 2014, I relapsed. Like many who go through addiction, my recovery was non-linear. Terrified, I went back to 5-Star Recovery. This time I did it for me. I faced my demons, embraced therapy, and found strength through faith. While in treatment, I also got my CDL and became an over-the-road truck driver. Those long drives gave me time to think, to pray, to heal, and to rebuild. I have now been in recovery for nearly 12 years. But even as my life improved, I never forgot the barriers I faced, the lack of culturally aware programs, the shame and the stigma in my own community. That is why I founded Rahma Recovery Center, to give my community what I never had, a space that honors culture, faith, and recovery. Our flagship home, Salam House, became Washington's first accredited Level 2 culturally responsive sober living home for East Africans and Muslim men. We provide dignity, safety, and belonging to men in recovery. We host Narcan trainings and address substance use disorder and mental health stigma in our own communities, and partner with community organizations like Living Well Kent and the Somali Health Board to create healing rooted in culture and understanding. But the truth is, we are struggling, not because the need isn't there, but because culturally grounded programs are still underfunded and overlooked. Help cannot be one size fits all. Traditional systems are failing communities like mine. Our Salam House model is a proof that recovery is possible when systems work together with compassion and cultural understanding. I am living evidence of what happens when justice, treatment, and therapy align. There are thousands like me still waiting for that chance. Let us make sure behavioral health care in King County reflects all of us, our cultures, our languages, our humanity. Thank you.
We will share the third recovery speaker right after this short 30-second timeout.
She has always been your baby, but when your daughter got into drugs and alcohol, she turned into a stranger. What do you do? Where do you turn? Contact Sundown M Ranch. Sundown's nationally recognized youth treatment program guides young people back to a life free of drugs and alcohol. All treatment is gender specific and directed by caring certified professionals in a safe environment. You can get your daughter back and get to know her again. Go to www.sundown.org to learn more.
And now, as promised, another example of recovery advocacy.
I'd like to introduce our final recovery speaker of the evening. Please help me welcome Rocket Garcia. Rocket is a 26-year-old artivista. She is both an artist and an activist. Through her love of the arts and working with community, she advocates for indigenous sovereignty, ending homelessness, and juvenile justice reform. Rocket brings a courageous and insightful perspective on trauma, healing, and recovery. She is proof that healing and transformation are possible. Please welcome Rocket.
My name is Rocket Garcia, granddaughter of Martha Maldonado of the Hopi and Taino, and I have struggled with mental health for as long as I can remember. As a kid, I missed a lot of school and frequently complained of stomach aches, which I now know can be how children express that they're anxious. I cried a lot, so much so that my peers referred to me as the girl who cries for no reason. I was always reading, drawing, or playing outside where there were fairies, magic, fantastical creatures, and I didn't feel so alone. I was one of those kids waiting for my Hogwarts letter, a white rabbit, a tornado, anything to transport me to a magical place away from the isolation, couch surfing, and frequent sexual and psychological abuse. Around 8 years old, I began to experience something that I called the pulling. I would lock myself in the bathroom and lay on the cold tile floor as a horrible dread seeped in. It felt like I was being pulled apart from the inside out, holding myself back from thrashing and screaming because I couldn't let the people we were living with hear me. As I grew from child to adult, I found that there were no fairy circles or portals to escape through. My behavioral health issues grew worse as I experienced more intense traumas and my unhealthy coping skills escalated. Because my abuser groomed me to have no boundaries, privacy, and to not trust my intuition, I became an easy target for other predators who took advantage of me. I tried to control my life through eating disorders, improve my self-esteem through sex addiction, and chase euphoria through passive suicide. My biggest challenge has been my amnesic barriers. There were large pieces of my life missing from my memory. I had developed serious dissociation because of my continuous and severe childhood traumas. I was damaging my relationships beyond repair, missing classes and work, and in general struggling to get my life started. The fall before my 25th birthday, I started having something similar to a quarter-life crisis. Up until that point, everything I did was to try and numb myself from my thoughts, memories, and experiences. I turned around, looked at all of my problems, and said, "Just what the heck is going on around here?" I could no longer ignore how sick I was from my combination of meds and overworking. So I applied for short-term disability, and for the first time in my life, I sat with myself and really listened. At that time in fall of 2023, my worst nightmare was the thought of my abuser dying. I didn't want to feel helpless anymore, and I needed to believe that I could survive on my own. But in order to do that, I had to accept that my abuser was not my savior. I was the only one who could save myself. I'd been friends with a guy named Jonas for a couple of years. We had met while doing activist work together in LA. We were both in rough living situations, so we put our heads together and made a plan to escape California. While doing so, we fell in love. For the first time, someone was helping me to keep track of my dissociation and memory lapses. He encouraged me to write things down, to talk aloud to myself, and to use grounding techniques. I was able to start piecing together the truth. I didn't need my abuser. They needed me. There were times in the coming months that I didn't think I was going to make it out of California. My abuser did everything in their power to keep me from moving, including taking my car. People showed up to my house unannounced, begging me not to leave. But in January of 2024, Jonas and I made it here to Washington. It was a little bit of a rocky start, but we figured it out. You can clap. It was impactful. I took steps towards self-sufficiency by learning about what resources were available to me. I took the bus every week to Pier Seattle, where a peer helped me reach my goal of housing stability. Jonas is a former foster youth, so together we were able to use the FYI housing voucher. I began prioritizing and taking charge of my health by getting Apple Health, EBT, and ABD. Because of this, I'm back in therapy, which is helping tremendously with giving me a safe space to grow and heal. When I look back on my memories from before, it feels like a different life. Part of my recovery is affirming to myself that I am safe and deserve to have the life I do. I deserve to have an incredible boyfriend. I deserve to co-parent a one-eyed cat named Remy. I deserve to have my own apartment where I feel safe to live and be myself for the first time. I deserve to move slowly, focusing on my health instead of being in chronic survival mode. I'm reaching out to people from my past to try to help myself create a chronological narrative of my life. I'm also allowing myself to let go of the stifling narratives that have been created for me. I wouldn't have gotten here without lots of support. I want to thank my ancestors who guide me, the Van Antwerp family who gave me shelter during the pandemic, my dad and Jonas, my mentors Mayra Zaragoza and Kruti Parek, the Mockingbird Society and the Y Social Impact Center, and I want to thank King County. This county has given me indispensable support while I recover and claim the independence I've been fighting for my entire life. There are many things that I've had to leave out of my speech in the interest of time, but just know that it has not been as linear as this. There are multiple times that I tried to leave my abuser, only to find myself back there again with no memory of how. But now that I'm here and in recovery, I no longer have to look for fairy doors. I'm so grateful to have built myself a life that I don't have to dream of escaping. Thank you.
During these powerful stories of recovery, close to 20 legislators sat on stage and listened, many of them visibly moved by what they were hearing. I certainly hope you have enjoyed the highlights of the annual King County Behavioral Legislative Forum. And by the way, I want to remind listeners of this podcast, if you would like to tell your story of recovery, regardless of the path that you've chosen, as long as you've been in continuous recovery 1 year or more, please drop us a note at recoverycoasttocoast@comcast.net. Well, that wraps up this edition of Recovery Coast to Coast, the national podcast. If you've enjoyed our podcast, please share it with others via social media or simply telling a friend about it. You can find all of our podcasts at recoverycoasttocoast.org. And if you'd like to get in touch, our email is recoverycoasttocoast@comcast.net. Also, please hit the subscribe or follow button. It's free, and you'll be notified the next time we publish a podcast. And remember, if you know someone who is experiencing problems with alcohol or any other drug, there is help available. We encourage you to check out findsupport.gov. It's a website designed for individuals, families, and friends. It has information on how to pay for treatment, including low-cost and free treatment options. Find healthcare support, how to help someone else, or find help for yourself. It's all at one place, findsupport.gov. And join us next time for America's Voice for Recovery, Recovery Coast to Coast, the national podcast. And another shout-out to our sponsoring organization, Sundown M Ranch, where recovery begins, sundown.org. I'm Neil Scott, reminding you to stay healthy, live in gratitude, and be kind to others. Remember, the bright side of addiction and mental illness is recovery. Pass it on.